Hey everyone, this is Emily Glasser, clinical nutritionist, acupuncture physician, and your functional medicine physician. Most people are overwhelmed right now with all the information out there about this novel coronavirus or COVID-19, but please stick with me because rather than just numbers or theory, I'm going to tell you what's really working in a clinical setting to keep our patients safe and healthy. You see, we have decades of knowledge about viruses and how to support the immune system. And we need to systematically apply that information now with a calm head. There's a lot of disinformation, misinformation, and honestly, some real garbage information being thrown around out there. So let's take a look at reality for a minute. You see, viruses all basically do the same thing. They invade a cell and then co-opt themselves and co-opt some of their components to make many copies of themselves. And those infect other cells and then sometimes infect other people. The difference between a coronavirus that causes the common cold and one like COVID-19 is that it can infect the lower respiratory tract in the lungs and lead to things like pneumonia. Because of these viruses, because they live in the lungs and they can get in and out of the airways pretty easily, this is what makes them more infectious. But among a large early group of patients diagnosed with this new coronavirus in mainland China through February 11th of this year, the death rate was highest for people over 60 years old and those with underlying illnesses like autoimmune diseases or secondary infections. It's always been true that a comprehensive strategy is necessary to fight any virus. And in our clinic, our nutrition supplement strategy includes support for inhibiting the way the virus attacks us and inhibiting the way the virus reproduces. We have effective immune support protocols that provide this comprehensive support, and those protocols are tailored to each patient's specific situation. You see, prevention is always the way to go, rather than waiting for symptoms to develop. We must also strengthen the immune system and our whole body health in general. And I want to emphasize this last point. True health is not being free from symptoms, but rather having a body that can adapt to stress without breaking down. This stress can be from an injury, from a toxin, from a virus, and even things like this COVID-19 virus. Your body's adaptability to stress without breaking down is called your health adaptation response. And we want to do all we can to keep our natural resiliency high. Nutritional care and acupuncture care is part of your program to strengthen your body and your immune system, and this includes reducing inflammation and increasing your body's resiliency to this stress. The medical literature supports the role of both good nutrition and acupuncture in improving your immune system. And many of you already understand this because you've experienced an improved immune system function over the time that you've been receiving care. And we want you to be able to continue to do this. To make our office safe for you to get both acupuncture and nutritional care, we've taken the following precautions. 1, always washing hands in between patient visits. 2, regularly using alcohol-based hand sanitizers. And 3, like we've always done, using disposable rubber gloves when we need them and using disposable protective head coverings for the headrests and disinfecting all surfaces with a medical grade sanitizer, which gets wiped down in between each and every patient. Also, please note that the Center for Disease Control does not recommend that people who are well wear face masks to protect themselves from respiratory diseases, including COVID-19. And so you won't see us wearing face masks. But please know that a face mask should be used by people who do show symptoms of COVID-19 to help prevent the spread of the disease to others. We do recommend that if you've recently come into contact with a symptomatic person or that you're experiencing a cough or fever or difficulty breathing, remain at home. Rest and get the appropriate testing. All nutrition and functional medicine appointments can be done on the phone or through Skype or FaceTime. If you're scheduled for acupuncture and you are symptomatic or have come into contact with someone with COVID-19, we ask for you to stay at home. If you're unsure of whether to keep your appointment or not, please email me or call the office. In summary, if you're asymptomatic and you're not in the high-risk group, we recommend that you keep your appointments because it's for your own benefit. And know that our office is taking every precaution to keep you safe. In the end, we can't avoid this. We have to go through it. And rest assured that I am with you and remain dedicated to your health every step of the way. And together we can expect to emerge stronger. So stay calm, be smart, and let's keep ourselves in the best position to remain healthy and happy. From myself and my family to yours, together we're stronger.